Eric, I just have a question for you before you kind of flip into the next question. And I'm from Alberta, and on Sunday around I think it was about 4:30 in the afternoon, we got the shocking news that all Alberta schools were closed. And this was in regards to our first community spread in Alberta this weekend. And I just wanted to get a sense from you. So if you're in Alberta and there are many schools that are being closed, spring breaks are being extended, and I just wanted to get your thoughts on kids with IBD, school closures, and what parents should be thinking about in this time in regards to precautions.
Yeah, so I think now all the provinces, I could be wrong, but I believe all the provinces have closed public schools. I think private schools, it depends on the school, although in Ontario, they've mandated closure of all schools, private schools included. Daycares, again, it depends on the daycare. I think, people still need daycare services if they're working, but I think daycares have become much better at screening kids and parents at the door and not allowing people who are sick to go in. And I think that's the right thing to do. I mean, as a pediatrics resident, I got sick on a regular basis. Obviously, I'm exposed to all sorts of things in the hospital. I've never been so sick in my life than when my kids started going to daycare. Like, never. Got things that I hadn't had since I was 5 years old. So, especially in this case where kids are either very, very mild symptoms and may just be cold-like symptoms or even flu-like symptoms, the ease at which they will spread the COVID-19 virus around is pretty scary. And so we're not so much worried about the kids getting sick, but we're worried about the kids getting the virus and then passing it on to people who are vulnerable and people who are at risk of complicated COVID-19. So I think that closing schools was the right thing to do. Again, I'm a parent of 3 kids, and I completely understand the frustration and the pain of having 3 kids at home. And really, it's my wife who's helping the most. She's become a stay-at-home teacher, which was not her original profession. But I think it is the right thing to do. Now, what do you do with your kids at home? I think that's the big question. Uh, there's lots of activities that you can do at home. There's ways of keeping them busy, some of them productive in terms of activities and learning, some of them not so productive in terms of iPads and devices. And we're not saying that they need to stay inside for the next X number of weeks, right? We're saying that keep them away from people as much as possible, and especially keep them away from large gatherings like you get in school. So as the weather warms up, hopefully soon, going for a bike ride is fine. Even playing outside with friends, as long as they keep a safe distance, throwing a ball around, doing stuff like that is probably fine. I think parents have asked about play dates and that sort of thing. And certainly large play dates of multiple children, not a good idea. Birthday parties, unfortunately, my daughter's turning 10 in 2 days. So what is that, Saturday? And we've had to cancel her birthday party. She was planning a sleepover party, but that is really the safe thing to do. Occasional one-on-one play dates. I think you have to judge based on what you feel comfortable as a parent, and certainly make sure that nobody's been traveling and nobody has any sort of symptoms at all. But the best case scenario is avoid other people and stay 2 meters apart, especially if you're immunosuppressed. So a lot of these instructions are really for kids who are not immunosuppressed. But if your child is immunosuppressed because of IBD, try to stay away from other people as much as possible.
So maybe we can get to the next question.
Yeah, absolutely. Well, actually, Lisa, do you sort of agree with that recommendation? I know it's hard to stay away from play dates and stay away from other kids.
You know what? My advice lately has been dates, play dates, adult or pediatric. Cancel your play dates for now. Put a little hold on the play date. It's really tough. I don't have kids, but I sometimes adopt them and borrow them. It's really hard to make sure that they're not doing this, that they're not touching each other. That's what kids do. I love that part. But other than, a big field with one ball that everyone just kind of tosses around with their feet, my advice, honestly, and I know this is really hard, has been no play dates for adults and no play dates for kids for now. And let's reassess in a couple of weeks. It's not forever. Let's put a horizon on it. Give ourselves a horizon to look at, and we'll see where we go. If we miss this golden hour of flattening this curve, to put it bluntly, we're kind of in a bad place. And that's not just for people who are immunosuppressed with IBD, but for the country.
Yeah, it's Remo, and I just want to add that. So I have young adults, and I think it's a tough time to be a parent, because even sort of teenagers, and they're like, oh, I still want to see I'm out of school, I'm doing my courses online, and I want to see my friends. Again, I think that we all need to be vigilant here. I got an email this morning from the parents, one of my IBD patients says, can the boyfriend come over and a few friends because they're so bored? And it's like, absolutely not. It's like, you have to stop that behavior. And I think as parents, even if you have, for IBD patients, you're worried about your own disease. And now it's even tougher to be a parent. But I think it's so important to send those messages.
Thank you.
Yeah, I think if I could add to that quickly, again, it comes back to making a decision. I know that this condition is imposed on us. We're not happy about it. I understand that we have behaviors that we like, that we enjoy, that's been part of our lives, and now it's disrupted. And that's why I call it a decision. It's not easy, but you have to understand and be informed of what's at risk, like Lisa said and other people have said here. I think that's really important, because if you actually take it serious and make the decision, then that gives you a sense of control. And that's what we've heard a lot about, feeling out of control. I think that sense of making the decision to do this in the right way is something I've encouraged all my children to do. And they've run the gambit of being a little bit younger to a little bit older. So I think the idea for me has been, make your decision. And when you challenge them that way, I think kids are quite capable at certain ages to make those decisions and be actually pretty proud of it. So I think I would encourage people to think of it as a decision when you go to talk about these. Be the dot and make the decision.